Among the key achievements celebrated in Africa today are those in the fight against the spread of HIV and AIDS. Incidences of HIV and AIDS have declined markedly in 22 countries, with more than half of the 6.6 million people in need of treatment receiving it. In Kenya, CCTV correspondent Jane Keogh spoke to Joe Muriuki, an HIV-positive man who devotes himself to the fight against the spread of AIDS.
Getting to where he is now has not been an easy journey. But Joe Muriuki is indeed an extraordinary man. His is a tale that kept the nation talking when loud silence was the norm. Joe was the first Kenyan to go public about his status soon after he tested HIV positive.
My main motivation was to actually present proper perspective and reality of living with HIV, which was completely different from what was prevailing at that particular time.
The world Joe Muriuki lived in then was different. Those days, being found to be HIV positive was akin to a death sentence or having doom spelled on one's face. With Kenya's first HIV case having been diagnosed in 1984, people had limited knowledge on the virus, and this widely affected their behavior and their attitude. The stigma that followed tested Joe and his family to the limits. His wife Jane, who had tested negative, was 3 months pregnant with a third child.
One thing that happened to Jane is that she lost her job. They refused to open a bank account to me on account that I was just dying.
You find yourself in a different corner of the class. You don't have a classmate, you're seated alone.
But 22 years on, as millions succumbed to the pandemic, Joe is still going strong, and it was only this December that he was put on antiretroviral treatment.
It was more to do with my attitude, more to do with the involvement with my work, with not being distracted.
Today, Joe, who did not have a diploma when he tested positive, holds a master's degree in public health and is currently studying for his PhD. He's also the regional coordinator for the Network of African People Living with AIDS and is also a member of the HIV/AIDS Tribunal in Kenya that receives complaints on HIV issues.
I really talk about abstinence because I understand from the word go the risks that are there.
It has made me realize that you're not supposed to hide from something that you feel is bad.
Something you get, then you have to change your life after you get, so you have to live positively.
There is a lot of difference, lots of difference. Stigma is now not so much of an issue.
More than 1 million people in Kenya are currently infected by HIV. An almost equal number of children have been orphaned as a consequence. But Joe's story continues to inspire millions more who have to face the virus each day. Jane Keogh, CCTV, Nairobi, Kenya.